One of the first things most people do when they are struggling with low back pain is search for stretches to relieve their pain. But the truth is, many of these stretches can actually make things worse. In this video, I will demonstrate some common mistakes people make when trying to improve their low back pain, along with 5 exercises you can do from home to help strengthen and improve your low back mobility. First, let's briefly go over the low back anatomy. The low back, also known as the lumbar spine, consists of 5 vertebrae, L1 to L5. These vertebrae support the weight of the upper body and allow for flexibility and movement, such as bending and twisting. In between each vertebrae are intervertebral discs, which act as shock absorbers. The ligaments of the low back play a crucial role in maintaining stability, limiting excessive motion, and protecting the spinal structures during movement. These ligaments connect the bones and support the alignment of the spine. Many layers of muscle attach to various parts of the low back, providing support and influencing movement. The low back houses major nerves, including the sciatic nerve, which can be affected by restriction or dysfunction in this area, leading to pain or numbness radiating down the leg. There are various causes to low back pain, including a herniated disc, degenerative disorders, inflammation, spinal stenosis, irritated nerves, strained muscles, compensation patterns, the list goes on. So to be sure, see a healthcare professional if you are unaware of what might be causing your low back pain. For most people, their lumbar vertebrae are in a flexed position and limited with extension. The neutral position of the lumbar spine is an extension curve. Many factors lead to the spine adapting into the flexed position, including prolonged sitting, deep couches, car seats without lumbar support. Simply put, spending too much time in that position and not enough time in extension. If you look online for low back stretches, many of them place your back into a rounded flexed position. For example, if we look at the single leg knee to chest, double leg knee to chest, and standing toe touch stretch, all 3 of these movements increase spinal flexion. Spinal flexion is not the issue, but instead the issue arises in the fact that you are trying to stretch tissues that are already on tension. Instead, try these 5 exercises. The first exercise is lumbar extension. Lie face down on the floor with your legs extended and feet together. Place your elbows directly under your shoulders, forearms flat on the floor. Slowly lift your chest while keeping your hips and lower body in contact with the floor. Hold the position for 5 to 10 seconds, feeling a gentle stretch in your low back. Return to the starting position by slowly lowering your chest back to the floor, and repeat. You can either use this as a stretch or keep it dynamic and go from one position to the next. The next is opposite side Superman. Lie face down on the floor with your arms extended in front of you and your legs straight. Simultaneously lift your right arm and your left leg off the floor, engaging your lower back and glutes. Feel free to keep this movement dynamic or hold this position for 3 to 5 seconds, focusing on keeping your limbs extended. Repeat on the opposite side for 5 to 10 reps. Cat-cow. Start on your hands and knees in a tabletop position with your wrists under your shoulders and your knees under your hips. As you inhale, arch your back, drop your belly towards the floor, and lift your head and tailbone. Exhale, round your back, tuck your chin towards your chest, and pull your belly button towards your spine. Continue to alternate between these 2 poses in a flowing motion synced with your breath, and repeat for 10 to 15 cycles. Quadruped arm and leg raise, also known as the bird dog. Start on all 4s with your wrists directly under your shoulders and your knees under your hips. Extend your right arm forward and your left leg straight back, keeping your hips square and your core engaged. Hold this position for 3 to 5 seconds, maintaining balance and alignment. Slowly return to the starting position and repeat with the opposite arm and leg. If this is too challenging, just do 1 arm or 1 leg at a time. Perform 10 to 12 reps on each side. Lastly, we're going with a glute bridge. Lie on your back with your knees bent and feet flat on the floor, hip width apart. Place your arms by your sides, engage your glutes and core, and lift your hips off the floor until your body forms a straight line from your knees to your shoulders. Make sure not to overextend the low back. Hold the bridge position for 3 to 5 seconds, slowly lower your hips back to the floor, and repeat for 10 to 15 repetitions. If you found this video helpful, please like, share, and subscribe, and I will see you on the next video.